So, how did we get here? I mean, from chaining people up in asylums to just sitting on a couch and talking about our feelings. It's a huge leap, right? Well, this is the story of how talk therapy was born. And trust me, it was a revolution. Let's get into it. Just take a look at these two images for a second. On the left, you've got an asylum from the 1700s. It's pure chaos and brutality. Then on the right, you have a modern therapy session, a space built on empathy and healing. The journey from that painting to this quiet conversation, it's nothing short of a revolution in how we see the human mind. So how did that transformation even happen? It all started with a revolution in care that basically took mental health care out of the dungeon and into the doctor's office. You have to remember, for centuries, mental illness wasn't seen as an illness at all. People thought it was a moral weakness, or even that you were possessed by demons. And the treatments that came from that belief, well, they were often brutal, and in a lot of cases, even lethal. But then, in the late 1700s, this French physician, Philippe Pinel, he came along and challenged all that cruelty. He had this radical idea: what if we treated patients with kindness instead of as prisoners? His famous order to literally unlock the chains in a Paris asylum, that became a powerful symbol that kicked off a whole new movement toward compassionate care. Okay, so that shift from cruelty to compassion was a massive first step. It paved the way for actual, real treatments. But what does therapy actually look like today? Let's take a look at the modern framework and its two main branches. At its absolute core, therapy is any kind of treatment that's meant to help people feel better and just function more effectively in their lives. It doesn't matter if you're going through a really tough time or you just want to understand yourself better. The goal is always about improving your well-being. As you can see here, there's a huge split in modern treatment. One path is biomedical therapy, that's using medical stuff, like medication. The other path is psychotherapy, and that's what we usually call talk therapy. For the rest of this explainer, we're going to zoom in and focus on that psychotherapy branch. But even inside psychotherapy, there's another important distinction. You've got insight therapies, which are all about understanding the why behind what you do, getting to the roots of your thoughts and feelings. And then you have action therapies, which are focused on the how to directly change a specific behavior. Today, we're going to explore the two foundational insight therapies that really started it all. And, when you talk about insight therapy, you pretty much have to start with the guy who invented the talking cure itself, Sigmund Freud. So let's take a look at his whole approach of looking inward. Ah, yes, the couch. It's the iconic image of therapy, isn't it? And it all started with Sigmund Freud. He actually had his patients lie down because he thought it would help them relax and speak more freely, without being influenced by his reactions. This method he developed became known as psychoanalysis. Freud's core belief, which came from treating patients with conditions like hysteria, was that our biggest problems come from unconscious conflicts. Desires, memories, and fears that are buried so deep we don't even know they're there. The whole goal of psychoanalysis is to bring these hidden conflicts up to the surface. I love this analogy of mental archaeology. It just nails it, doesn't it? The therapist is kind of like an archaeologist, helping the patient carefully dig through all the layers of their mind to find those hidden clues from the past that are shaping who they are today. So how did Freud do this mental digging? Well, he came up with some key tools. He analyzed dreams. He used free association. That's where the patient just says whatever comes to mind, no filter. And he paid super close attention to resistance and transference, looking for clues in what his patients avoided talking about or in how they related to him as a therapist. Dream interpretation was a huge cornerstone for Freud. He thought every dream had two layers. There's the manifest content, which is just the actual story you remember. But the real prize for Freud was the latent content. That's the hidden, symbolic meaning of the dream. He saw it as a secret message from the unconscious. Now, very few therapists today practice psychoanalysis exactly the way Freud did. I mean, it could take years. The modern psychodynamic approach is much more streamlined. It's shorter, it's more direct, and it focuses on the client's current life, all while still honoring Freud's big idea about exploring our unconscious patterns. But not everyone agreed with Freud's focus on all these hidden conflicts and a troubled past. A whole new school of thought popped up that had a much more optimistic view of human nature. And this brings us to the humanistic approach, focusing on the person. This was pioneered by Carl Rogers, and his person-centered therapy offered a totally new perspective. It's non-directive, which means the client is seen as the expert on their own life. So the therapist's role isn't to dig around and interpret things, but to listen and provide a safe, supportive space for the client to naturally grow. This diagram here really shows the foundation of Rogers' whole approach. He believed that for a person to grow, the therapist has to create a growth-promoting climate, and that climate is built on these 3 essential elements you see here. Let's break them down. First, there's congruence. That means the therapist is genuine, they're real. Second is unconditional positive regard. The therapist is totally accepting and non-judgmental. And third is empathy, where the therapist truly tries to understand the client's feelings. Rogers believed these 3 things were so important because they create a space that's safe enough for a person to finally lower their defenses and start to accept themselves. So if psychoanalysis is archaeology, then humanistic therapy is like a supportive mirror. It doesn't dig for what's broken, it just reflects the client's own strengths and their potential for growth, helping them see themselves with more clarity and compassion. So let's put these 2 side by side. You can really see the difference. The psychodynamic approach focuses on unconscious conflicts from the past, and the therapist is kind of an interpreter. In contrast, the humanistic approach focuses on your conscious experience right now, and the therapist's role is to be a non-judgmental listener. And this all brings us to a final question to think about. When it comes to understanding ourselves, which is more important? Digging for the hidden roots of our past, or nurturing the plant as it is right now, helping it grow towards the sun? Both of these revolutionary ideas have shaped modern therapy, leaving us with a really powerful legacy of looking inward.